What is fentanyl? Fentanyl is a synthetic opioid that is significantly more potent than morphine and heroin. Originally developed as a pain management medication for severe pain such as that experienced by cancer patients or after surgery, fentanyl has increasingly been implicated in the opioid epidemic due to its misuse and presence in illicit drug markets. It is available in various forms, including patches, lozenges, nasal sprays, and powders, making it versatile and, unfortunately, easy to misuse. The potency of fentanyl is its most defining feature. It is estimated to be 100 times more potent than morphine, meaning that even a small amount can have profound effects on the body. In medical contexts, fentanyl is carefully dosed, but when used illicitly, it's often mixed with other substances, leading to unpredictable and dangerous outcomes. How does fentanyl kill people? Fentanyl's high potency significantly increases the risk of overdose. Like other opioids, it works by binding to receptors in the brain that regulate pain and emotions. While this can provide relief in controlled medical settings, excessive activation of these receptors suppresses vital functions, particularly breathing. A fentanyl overdose often results in respiratory depression, where breathing slows or stops altogether. Without enough oxygen, the brain and other organs begin to shut down, leading to unconsciousness, brain damage, or death within minutes. Compounding the danger, fentanyl is often mixed with other drugs like heroin or cocaine, often without the user's knowledge, further increasing the risk of overdose. The rapid onset of fentanyl's effects means that those who overdose may not have time to seek help. Even seasoned drug users can misjudge the potency of fentanyl-laced substances, leading to unintentional overdoses. How can Narcan help with a fentanyl overdose? Narcan, the brand name for naloxone, is a life-saving medication that can reverse opioid overdoses, including those caused by fentanyl. It works by binding to the same opioid receptors in the brain, effectively displacing the fentanyl molecules and reversing their effects. This action restores normal breathing and consciousness in individuals experiencing an overdose. Narcan is available in two common forms, a nasal spray and an injectable. The nasal spray is particularly user-friendly, requiring minimal training, which makes it a valuable tool for first responders, friends, and family members of those at risk of opioid overdose. However, there are challenges when dealing with fentanyl overdoses. Higher doses of Narcan may be required. Due to fentanyl's potency, a single dose of Narcan might not be sufficient to reverse its effects. Multiple administrations may be needed. Shorter duration of action. Fentanyl's effects can outlast Narcan's action, meaning that medical professionals should always monitor individuals post-reversal to prevent re-overdose. Importance of access to Narcan. Increasing access to Narcan is critical in the fight against the opioid epidemic. Many states and organizations provide Narcan kits free of charge or at low cost, and some pharmacies allow purchase without a prescription. Public awareness campaigns and training programs also aim to educate communities on recognizing the signs of an opioid overdose and using Narcan effectively. Conclusion: fentanyl's potency and prevalence make it one of the most dangerous drugs contributing to the opioid crisis. Understanding how it works, how it kills, and how Narcan can save lives is essential for combating this public health emergency. By expanding access to Narcan and increasing awareness of its life-saving potential, we can reduce the number of lives lost to fentanyl overdoses.